Hi there, it's Dr. Shiroko. I hope you're doing well today. Welcome to the first day of my seasonal reboot. Today I am doing the first day of my seasonal reboot, and many of you have joined me. But today I'm going to talk about fatigue because this is a time of year when a lot of people experience fatigue and may also be connected to when you do a seasonal reboot or any other kind of thing that involves changing how you're living or eating or doing things. So I actually made a few slides today, and so I'm going to share those with you and talk to you about fatigue, especially fatigue that's connected to still being tired. So today's talk is about why am I still tired? Dealing with fatigue even when you're taking thyroid medication and it's quote unquote balanced. So I'm just going to cover the following topics. Yeah. And so first I'm going to talk about thyroid balance and what has to do with thyroid and what you might be experiencing when you're taking thyroid. So a lot of times when you're taking thyroid medication, different people have different responses to different kinds of thyroid medication. And there are various elements that have to do with that. And so if you are taking thyroid medication and you're still tired, here are some of the reasons that you might be, or things you might be experiencing. One is that you may be taking the wrong medication. So there are many different kinds of medication out there, and different kinds have different elements to them. And so you want to just going to put on do not disturb. So you want to make sure that you're taking a medication that feels good to you and that you're getting the optimized result with that. Another element could be the time of day that you take it and what other things are you're taking at the same time. So you want to pay attention to that. You might ask questions. You may develop a resistance to a certain kind of medication. Some people may be on Armour Thyroid for years, and then suddenly it's not working anymore. And it could be that they've developed a resistance to it, or the formulation has changed. So there's so many elements involved in just the factor of taking thyroid medication that have to be examined. Another thing could be what dose you're taking, because a lot of times when you go to your doctor, all they'll test is this thing called TSH, which is your brain telling your thyroid what to do. And if your TSH is okay, then it's assumed that your thyroid is also okay. And that may not always be the case. So you want to make sure that if you are taking thyroid medication, one, that the dosing works for you, that you're not resistant to the medication, and that you're getting a medication, again, that might work for you. And again, there are several different kinds of medications. And then there are other things that may be playing a role in not feeling or still feeling tired, even if you're on the right medication. And this is actually also any kind of fatigue. So if thyroid is not the only reason that people feel fatigue. And here are some of the many possible things that could be affecting your response to your thyroid medication, or the things that could be affecting you if you're not on thyroid medication. So one main thing that is related to fatigue is digestion. So, and there are many components to your digestion as well. And here's just a small list of what could be going on with your digestion. So you could be experiencing hidden infections and not know that you have them, or there could be an imbalance in the bacteria that are living in your guts or the microbiome. You may not have enough stomach acid. You may not, your gallbladder may not be functioning smoothly, or if you've had your gallbladder removed, then the gallbladder's, the bile is still made by your liver, but it may not be being delivered correctly. Your pancreas may not be functioning well. And this is a thing that a lot of people don't know about, but your pancreas releases the enzymes that help you digest food, but it also balances your blood sugar by releasing insulin and regulating the blood sugar elements. So if your pancreas isn't working well, then you may not be digesting your food, you may not be balancing your blood sugar correctly, and these things may not be noticeable on standard testing. So this is one of the reasons I do Chinese medicine, is because in Chinese medicine, how the organs work is very, very different. And so if your pancreas isn't working well in Chinese medicine, that would be your spleen. And your spleen's job is to take in food, transform that food into energy, transport it to the rest of your body, and then it regulates the strength of your muscles, your ability to focus, it makes the blood, which is the same as what the spleen does in Western medicine. It also regulates, holds the organs in place, holds the blood in the vessels. And so there's a lot of different things that the spleen does and can show up on a Chinese medicine exam rather than showing up on a Western medicine blood test, although some of those things will also show up on Western medicine blood tests. So both are useful things to do when you're looking for answers as to why your digestion might be an issue. Another thing that could be a problem when you're having issues with digestion is the motility of your digestive system. So in your stomach and your small intestine and your large intestine, there's smooth muscles, and there's a thing called movement of those muscles that helps the food get pushed through your system. And it's more recent discovery, but if you're having trouble with the food going through your system, then you can get things like bloating and gassy, and many of you have heard of small intestinal bacterial overgrowth. And you could have small intestinal bacterial overgrowth because the food isn't moving through your small intestines, and that's affected by motility. And there are certain supplements and sometimes certain medications that will help intestinal motility. Another thing that I didn't write here is your vagus nerve. If your vagus nerve is not working well, and that there could be lots and lots of reasons for that. The vagus nerve is the longest nerve in the body. It starts up here, or it comes out from your brain up here in your ear, and then it travels all the way down to your large intestine and sends signals to your stomach, your small intestine, your pancreas, to your, like it's the nervous system that helps you rest and digest. It also sends signals to your heart and your lungs because it regulates the speed of your breathing and the speed of your heart rate as well. So it's a big nerve. And any kind of head injury, neck injury, trauma, emotional traumas, all kinds of things affect your vagus nerve. And there's a lot of newer science about how the vagus nerve works that is showing that if we start to work on helping the vagus nerve, we can really make a big difference. I've talked about Chinese medicine a little bit and digestion, and then I've also talked a little bit about microbiome balance. So I'm going to take you back to this slide and show you other possible reasons for fatigue. So other possible reasons that you may have fatigue are that you may have an autoimmune condition. If your immune system is attacking your own body, there's a reason for that. And a lot of times the only diagnosis you get is that you have an autoimmune condition, meaning your immune system is attacking a tissue. So in the case of the thyroid, your immune system could be attacking your thyroid. Well, let's assume that your body's not stupid. It's a smart body and it knows what it's doing. And so if it's responding inaccurately to something, that there may be a reason for that. In one of my talks, I talk about the possibility that our testing is not sophisticated and that we're not able to sometimes see the reasons behind the certain things that are happening. And that's always been the case for as long as I've been a physician. There are limits to our ability to find things when we test for them. And of course, they have consistently improved all the years that I've been doing what I do, but there's still times when the testing does not fit or does not answer the question. So in autoimmune conditions, Your immune system is attacking a tissue, and there's usually a reason. And it could be there's a toxin, which I've mentioned. There could be an infection that has not been diagnosed, and there are viruses that we still don't diagnose well, but famously Epstein-Barr virus is one of the reasons that there are autoimmune conditions. Some people, the Epstein-Barr virus could be in their adrenal glands. For some people, it could be in their thyroid. And it can start to wreak havoc on your system because your immune system says, I don't want this here, and starts to go to attack it, which is why you then get diagnosed with an autoimmune disease. But it can also be something like gluten or a food sensitivity, or an emotional trauma from the past that can affect your body and cause it to attack itself. And then there could be sleep issues that could be causing problems with your immune system. It can also, of course, if you don't sleep well and you don't know it. I remember I had a patient a few years ago, and she did not know that she didn't sleep well, but for some reason her husband had a sleep study, and so did she. And she found out that she was like holding her breath like 59 times in an hour or something, like almost every minute. And she wasn't overweight, and she wasn't a person who you would think would have sleep problems except for hormone imbalance because she was in menopause. But she wasn't aware of it. She thought she was sleeping well all night long. So it's possible that you have a sleep issue that hasn't been diagnosed or seen, and that might be why you're tired all day long. It can also explain why your energy isn't exactly what you want it to be. There's also issues with your adrenal glands, and your adrenal glands make many, many different hormones, and they also metabolize them in different ways. And so your thyroid isn't the only reason that your energy levels might not be good. There's hormones like DHEA and pregnenolone, which are sort of the high up in the chain of hormone production. And there are other hormones also made by the adrenals. And after menopause, you make estrogen and progesterone in your adrenal glands as well. So even though in premenopausally you made those hormones in your ovaries. And there are ways to address all of these issues. So this is just how I wanted to show you about fatigue. And now I'm going to come back to you. Hi. So I hope you're all here and watching this and enjoying this whole presentation. So as you can tell, there are a lot of possible reasons that you might have fatigue, even if your medication on your thyroid is okay. And if you have questions, please post them here in the comments and I'll be happy to answer them. And I want to just say that there are always possible solutions, and by digging into the root causes of what might be going on, and you can see that there's a large number of possible reasons that you could have fatigue, and that those can be rooted out, so to speak, and then we can do things to help you feel better in a step-by-step manner. So thank you so much for being here, and since I don't see any questions posted right now, I will come back and visit later and see if you've posted any questions in the comments. And I hope you have a wonderful day. And if you're on the seasonal reboot with me, yay, we're going to do it in the next 2 weeks. We're going to have a lot of fun, and we're going to share recipes. And so if you're interested, please join us. And if not, I'm going to do it again in April. Okay, have a wonderful day. Thank you so much.